So what risks does this strain pose to the general public?
Very little risk to the general public. This isn't something that you get casually. It's not COVID, it's not influenza, and it's certainly not measles. This is something that requires prolonged close contact, often with exposure to saliva, body fluids. So when we see these types of secondary cases, they're very, very rare. So I suspect that all of this contact tracing of people who were in contact with individuals is probably going to end up not picking up any cases. There's a possibility that some cases might occur, but I don't think it's a very high possibility.
You say this strain of hantavirus is not easily transmissible, but what if it mutates? Could that happen?
Everything that lives mutates. Every virus, every microorganism mutates. But for it to mutate in a way that makes it more transmissible, I don't think there's any evidence for that. They've sequenced the virus already, and it doesn't show any mutations based on kind of the ancestral strain that's always circulated. And what we're seeing right now biologically is this is behaving exactly like Andes virus operates. This is what we would expect. There's nothing new in the transmission dynamics. It's just happening on a cruise ship, and it's on the news all the time. That's really what's different. We've seen outbreaks of Andes virus before. The biggest one, I think, is around 34 patients that occurred in Argentina, and that all involved close contact with individuals. So nothing is changing that calculus at this point.
The mortality rate associated with hantavirus is very high, between 32 and 38%. What makes it so deadly?
Well, first is that we don't have any vaccines for it. We don't have any antivirals for it. So it's basically just supportive care. There's no curative treatment. And hantavirus, this strain of hantavirus, what it does is it damages the blood vessels around the lung, causing that the lungs, the air sacs, to basically fill with fluid. And that impairs oxygenation and can lead people to have respiratory failure. And then other organs can fail as well, including the cardiovascular system. So it is a very virulent organism, but that doesn't translate into it being more contagious.
You say this outbreak shows the need for more disease research and investigation funding. What do you mean by that?
Well, infectious diseases are kind of not really well appreciated, even after COVID. They go through boom-bust cycles of funding where it's not very sustainable. But we live in a world where there's lots of emerging infectious disease outbreaks. And this particular strain of hantavirus has been around since the 1990s, yet we have no countermeasures against it. So what we really need to do is be proactive when it comes to infectious disease threats, using all the tools at our behest, including things like mRNA vaccine technologies and other platform technologies, to be able to quickly respond to these and have treatments and vaccines for people so that you don't have this type of panic. All of these infectious disease threats are solvable with important research and a sustained funding method in order to do that. It's what ends up happening is we're reactive. So now there'll be a lot of interest in hantavirus countermeasures, but we've been talking about hantavirus since the 1990s at least.